Hello, everybody. Happy Wednesday. Welcome to the Convergence Health Workforce Wellbeing and Violence Prevention Improvement Series. Today is session 3 out of 6 sessions where we're looking at leadership-driven workforce wellness. So as a bit of housekeeping before we start today, we're going to have everybody muted while our speaker presents. You can use the chat box and we'll track your questions and ask Allison after the talk. She won't be answering questions during her talk. And then afterward, we're going to engage in a Q&A session. We've got some great questions to ask Allison, and if time allows, we'll work through some of those questions. So, brief introduction of myself. My name is Helen Craigie. I've been in the quality improvement patient safety space for over 10 years, and I'm a project manager with Convergence Health, and I am honored to be on this journey with you as we're learning about workforce well-being and violence prevention. Just as a little bit of context, I'm going to share some findings from a recent American Nurses Foundation survey. It was more than 7,400 nurses in the US answered a survey. This was about a year ago, May 2023. And some startling information in nurse turnover, burnout, and mental health. Nurse turnover is still above pre-pandemic levels, if that's a surprise to anybody. And the intent to leave remains high. So they indicated that 20% of respondents indicated that they changed positions in the last 6 months. And 39, so almost 40% of folks surveyed said they were likely to leave their current position in the next 6 months. And over 40% was for direct care nurses. Burnout remains very high. 56% of nurses are experiencing burnout as reported, and 64% said they feel a great deal of stress because of their job. There was a decline of positive emotions and feelings of empowerment among nurses, and negative feelings of stress and anxiety remain consistently high. As far as mental health, of those surveyed, 40% of nurses felt poor control over their workload and said their day-to-day work was hectic or intense. 2/3 of nurses who said they're suffering from mental anguish or toxic emotions are either not seeking or receiving mental health support. And that's, I think, due largely 56% said there's a stigma of healthcare provider associated with receiving mental health care. So this information, just setting the stage a little bit today, growing challenges indeed. And as a reminder, this is our schedule for this series. This is session 3 of our Wednesday session. So we're looking at leadership-driven workforce well-being, and we're hearing today from Allison Mincy from the University of Miami, Florida. So we are delighted to have you here today with us, Allison. And just by way of introduction, here's your bio. Allison Mincy is our Senior Vice President and Chief Human Resources Officer at the University of Miami, UHealth, which is University of Miami Health System and the Miller School of Medicine. So thank you so much, Allison. We are thrilled to have you here today to speak with us. And to start out your talk, we've been asking all of our speakers to answer these questions. We would be delighted for you to address why this topic is important to you personally. For one, why it is important to all of us here today, anyone viewing this webinar, and then also in the context of today in the larger environment, why is this topic important? So Allison, I'll hand it over to you.
Well, thank you, Helen, and greetings everyone from sunny Miami. I am delighted to be here with all of you this afternoon. I want to thank you all for spending some time with me on this important topic. In terms of answering Helen's question, there really is not very many other important things for people in all of our roles in leadership in healthcare than the well-being of the healthcare workforce. Since the pandemic, as Helen just described, with the high levels of turnover, the huge degrees that we all knew were a problem before the pandemic in terms of stress, trauma, resiliency, burnout. You all just saw the high statistics in terms of the burnout rate for RNs. I mean, and that is pervasive across the clinical workforce. We have all seen nurses and other healthcare professionals leaving the bedside, retiring early. A heavy emphasis and focus on well-being really does promote engagement, productivity. At the end of the day, all of us in healthcare leadership are really focused on, of course, delivering the highest quality of patient care at the highest levels of safety. And as we all think about this going forward, promoting the well-being of the healthcare workforce will continue to be critically important. So I'm really excited to talk with you all this afternoon a little bit about what we're doing here at the University of Miami. I really want to make this beneficial for all of you. So I want to share some of my thoughts and things that we have been successful with here at the university. But in addition to that, I do a lot of research in my discretionary time around how we can evolve in this space. So I'll talk to you a little bit about how I think about setting a strategy in this space, some of the trends that you should focus on, the real importance of the leader's role, not only in influencing and creating the vision and policy, but also in modeling behaviors. That is something that is critically important, and we'll spend some time on that. And then I want to make sure that we have good time to talk about data, the importance of data. We believe here at the university, what gets measured gets done. So we'll talk about that, and then we'll talk about some emerging trends. I'm going to advance to the next slide here. Back one. Okay, so I just covered what the agenda is going to be. We're going to talk about, and I really did just highlight, what I believe and what we believe here at the University of Miami to be the importance around workforce well-being. Again, I talked about the leader's role in terms of setting the stage for what we'll talk about here this afternoon. I'll also share with you some key elements, and I do want to note that, I know there's lots of different healthcare professionals and leaders from across the healthcare industry in large and mid-sized health systems and some smaller and rural location healthcare systems also as well. So I hope to be able to provide you with some flavor and examples of things that might be beneficial for you. And the insights to action piece is really going to be focused on the data. And I know that this is, something that we continue to evolve here at the University of Miami, getting really good, rich data sets that the clinical operations teams can put into action. So those are some things that I want to make sure that we talk about as well. And then some emerging trends. Okay. So again, I wanted to begin really with sharing with you about what our philosophy here is at the University of Miami in relationship to well-being. People in my seat used to look at and think more broadly about things like benefits, programs, policies, really with the pandemic, and maybe even a little bit before that, as we were looking at stress, trauma, resiliency, burnout, and how to combat those things with the comprehensive well-being program. We began to realize that you must look at both the community in addition to the individual. So both broad-based and then individualized and specific. So we like to look at really the 4 dimensions that are listed here at the right of the screen. Both, again, the communal focus, which is the community focused, physical, psychological, and not all organizations think about the financial acumen or aspects of the workforce in correlation with well-being, but that is something that we have found to be successful for us as we think about the continuum and making sure that we're developing a comprehensive vision and strategy. For us, it's focused on these 4 pillars. So let me dive a little bit deeper into these 4 pillars. So physical, this is something when organizations talked about wellness and well-being in the 80s and 90s, it was really around physical fitness and providing wellness programs like health screenings. Some organizations like us, we have multiple wellness centers. So the wellness centers, provide an opportunity to go at lunch or before or after work. But we understand that not every organization is of the size and scale where you can provide on-site fitness facilities. So for smaller organizations, you might find benefit from discounts to certain programs for smoking cessation, weight loss, those types of healthcare programs. In addition, looking at, continuing to look at, I should say, your healthcare plan and your healthcare benefits, and making sure that you've got those things structured in ways that can really promote ongoing preventive care Some typical things that we've done that I'm sure many of you do as well. You provide 100% coverage for preventive care benefits. Those are things that we have found to be successful. However, we did provide, I wanted to make sure that I mentioned to you this afternoon that you also, in looking at things that you want to do, new things or things that you want to continue, you also should really be thinking about operational efficiency and looking at the data and things that you should stop doing. So we were providing a benefit for credits for participation in certain healthcare programming that as we looked at the data, we saw that our workforce was at a time had taken benefit of it. And then, the most recent data set that we saw, they were no longer benefiting from it. So we've discontinued those credits in that program. It's just an example of you need to continue to look at the data, the take-up rate, and whether or not the programs that you're putting in place are benefiting the workforce. The second pillar that we focus on here at the University of Miami is psychological. This is something that, over the past 10 years has continued to emerge. We talked about when Helen was speaking about, some of the stigmas that have been associated with the focus on mental health. We believe here that that's something that we need to continue to heavily focus on. Looking at providing resources. We have a faculty and staff, because we're an academic medical center, faculty and staff assistance program. Many of you, I'm certain, have EAPs or employee assistance programs. Those can be either employees of yours as part of members of your workforce, or you can contract with a third party to provide those resources, including through your health plan. We have a bit of a mix of both, where we have the on-site, we have employees that actually work in human resources for us that provide those services to our workforce. In addition, there's a number of resources related to mindfulness. We offer a number of programs through our faculty and staff assistance plan that is focused on mindfulness. But there are a number of what I would call publicly available and free resources that employees can make available to their workforce. Before coming to the University of Miami, I was at The Ohio State University, and we had a program there that was exclusively focused on mindfulness, a fair amount of which is publicly available. And there was a very brief vignette that was about 30 seconds long that we continued to track the success rate of that vignette. Again, only 30 seconds long. It just provided for some calm music at maybe a moment where somebody needed to decompress given any type of event that was going on. And that relaxation for that 30 seconds was seen as very beneficial to the workforce. And the last that I had looked at it, it had been opened over 15,000 times, or listened to, better said, over 15,000 times. So again, resources that don't necessarily cost a lot of money to implement and or continue can be really beneficial for the workforce over time and at a low cost, like I said. And we also believe that, making sure that we're recognizing and rewarding both through a competitive compensation program, but in addition to that, individualized recognition and reward is something that our workforce has told us that is important to their well-being. So those are programs that we put in place that provide in certain locations, including our inpatient units, a small monetary award that's associated with that recognition, and that really has gone far. From a financial perspective, again, in addition to a competitive total rewards and compensation program that we are fortunate to be able to provide here, we also do provide for tuition remission. We are an institution of higher education, so that's something that we can offer here. But we also did an exercise where we asked the workforce to tell us how much student loan debt they have. And intuitively, we know that doctors, nurses, healthcare providers at large are going to come to us with some level of student loan debt. So once we went through that listening exercise, we then put into place a program where we are contributing a monthly payment to payment of that student loan debt for the workforce. And that's something that both promotes retention amongst the workforce, and then again, high levels of engagement And it helps to, of course, relieve some of the stress that they're feeling from a financial perspective. We are a destination city here in Miami, of course, as many of you are in as well. And so we have some issues, if not quite a few, with workforce housing that is affordable. So we put some programming into place to help kind of combat those pressures. We still know that, again, these are why well-being programs need to be paid attention to constantly. We still know that we must evolve our program. So we're constantly looking, my team knows I like to talk about this as the tools in our toolbox. So we know that we need more tools in the toolbox to support both housing, but also, again, being in a destination city, commuting and commuter benefits. Communal. So this is something that's really important to us here. We do have a comprehensive, I would call it a subset or another pillar below the overall well-being pillar in relationship to belonging. We want to make sure that we have good opportunity for every member of our workforce, not only to be valued as a member of our workforce, but also to provide a value. And that really for us is born in relationship to our comprehensive engagement program. We also have employee resource groups, and we have a very rich rounding and listening strategy that we're continuing to evolve. And I'm going to talk a little bit more about that in a minute. But also giving back. Healthcare workers, really want an opportunity not just to give back in the day-to-day in terms of their jobs and positions with us, but we also know from listening to them that they like to give back to the community. And we have a number of ways in which we do that here, including the Dolphins Challenge Cancer that's listed on the screen. And that's a bike ride, a multi-tiered bike ride for which we get philanthropy and donations in support of the riders. That's been really successful here for us. Go to the next slide here. All right. So I don't want to scare anybody by this really busy slide, but I want to move into the section of my discussion around setting the strategy. So I talked a little bit about our philosophy here at the University of Miami, some of the things that we're doing and how we look at the multi-tiers of our strategy that is born again from our philosophy. How I like to think though about establishment of a philosophy in relationship to your workforce is through the framework that is denoted here on this slide. So we have 5 generations, in the workforce here at the University of Miami. You may or may not have that many, but what we all know is that, we have lots of individuals within the workforce that are working longer than before. They're not retiring at the same time frame in which they did in the past. And their needs in terms of what they require as a member of the workforce at any point in their career can shift. An easy example is, the childbearing age. And we've got a lot of folks within the healthcare workforce that come to us within their childbearing ages. And they're, wanting to be a member of a community that supports having a family, flexible work. But then there are also people who enter into the workforce here that are at the very beginning stages of their career or at the end of their career. So we need to think about the workforce in that way and develop a strategy that is comprehensive, that can meet the needs of the entire community, and though that is both broad-based, because we still have to provide broad-based solutions, because we're not going to ever be able to meet the priorities of every single individual within the workforce. We have 20,000 people, give or take, that work here at UHealth at the University of Miami. And we provide broad-based programs. For example, the program that I mentioned in relationship to student loan repayment, those are the types of things that are not going to be a benefit to everyone. But there are other things that we're going to be able to do for other parts of the workforce. But you must have a comprehensive strategy that really thinks about, at least recognizes that you are going to need to have a multifaceted approach depending upon where the individuals within the workforce are within their careers with you. So as you think about developing your strategy, in addition to, again, recognizing that you're going to have to, at least in my humble opinion, have that multi-tiered approach, one of the most important things that you can do And there are many ways in which that you can do that, and you should, is to develop a listening strategy or strategies. And these really are important. In healthcare, we do a lot of rounding. Of course, that continues to be really important. Making sure that leaders are rounding, not just the leaders on the particular unit, but your nursing leaders, your overall operational leaders, and your department chairs in our world, or your division chiefs, making sure that they have an opportunity to engage directly with the workforce is important, but also creating, another effective strategy. We call it Powered by You. And this is our comprehensive engagement program. So we do, like I said, rounding, but we also have an engagement survey. We do that annually. We do it either in short snippets or a pulse, or what is referred to as a full census, where we ask the entire workforce a comprehensive set of questions that we both benchmark and track internally over time. But besides for listening and asking for information and feedback around what's important to the workforce, also it is critically important to share the results. It can be very dangerous to ask for feedback and not share the results. And then also too, you must act on those results. And when you create a program that has these three tranches to it, where you're listening, you're sharing, and then you're providing action around the results, you can really develop a very comprehensive and meaningful strategy that inspires confidence and trust, and it promotes that workforce engagement, that productivity, and the well-being that you're trying to get. But this has worked really well for us. We're still evolving it, and it's just really important to pay attention to. And as you think about setting your strategy, you want to be mindful of internal and external trends. So I mentioned earlier on that, we pay attention to the things that are working well for us, of course, and we like to promote and continue those things. But we also want to look at the things that are not benefiting the workforce in the same way that they did in the past, perhaps, and discontinue those things. But when you think about well-being trends kind of over time, and even some of the things that are still emerging, holistic wellness, this is, as I said in the beginning, really how we like to promote it and think about it here in terms of well-being, where we're looking at physical, we're also looking at psychological, we're looking at financial aspects as well, and we're looking at it both individually and then from a community perspective. That's more holistic. But there's some more specific trends, flexible work. We have done a fair degree of this where we look at our staffing model. We have different levels in terms of timeframes in which people can work. And we all know that the whole remote work conversation tends to have its opportunities with the clinical workforce, because many people have to be here to take care of our patients. But there are opportunities for others that are more in that administrative space, where they can work in a hybrid fashion. I will tell you, I get the question about remote work all the time. And I do believe that remote work will continue to be part of our future in some way, shape, or form. I think that many within the workforce demand some level of flexibility in that way. But the pendulum is shifting a bit more on site, as I think we're all seeing nationally, is that there are opportunities in the support of the remote workforce that we need to continue to evolve and think through, like the development of the remote workforce and engagement, and making sure there's still that opportunity to have the level of development that the remote workforce might perhaps have had in the past while they were on site. Thinking about workforce resiliency and mindfulness, I shared with you I think mindfulness, there's lots of opportunity to think about how we can provide moments of de-escalation and respite. One of the things that we've been able to do when I was at Ohio State that we were able to do was to provide $5 gift cards to the local coffee shop around the corner, just to give that healthcare worker the opportunity to step away from the unit for a minute and get a cup of coffee. Making sure, of course, they have the appropriate coverage, but there are moments in time where just listening to a mindfulness vignette, listening to a brief podcast, and getting a cup of coffee, and permitting the workforce to have those moments that are so needed for resiliency. Those can be part of either a comprehensive program where you specifically say you're going to do those things, and or just ad hoc as a leader feels like they need to permit that time to promote that level of resiliency is going to be really important. But these are just a few examples. But again, the reason why I've included these here is really so that you can see and think about as you are developing or as you're enhancing your well-being strategy, that you consider both, what you've done internally and has that worked, or could you do it differently? But also you're thinking about what are the other trends that are both or that have existed in the past and that are also perhaps emerging. And we're going to talk about those at the end here. Okay, so the leader's role. So when you're establishing a strategy, and I just gave you kind of, again, what it is that we're doing here at the University of Miami and some of the things to think about and how you establish a strategy. The leader's role is critically important in cultivating the workforce well-being overall in two really important ways, in my opinion. One of the most important ways is, just by virtue of being a leader, you have the opportunity and accountability to really set the vision, to communicate your vision. Also knowing though that you're not going to be able to do everything. You're not going to be able to do everything because you don't have the time and or you don't have the resources and or it doesn't align with your overall organizational strategy. So being very clear about the things that you're going to do and the things that you're not going to do after you go through this process of active listening and then getting the feedback around, again, what it is that you want to do overall in the well-being space. And, once you get to the point where you really do feel like you've got a good framework, you're going to want to make sure that you create policies that are appropriate. You're going to want to make sure that you provide resources. And you're going to want to make sure that you encourage participation. And not only, do you want to encourage participation, you want to model it. So I know this slide looks a lot like the one before, but the real emphasis and the difference is, again, by virtue of being a leader, you have the luxury, if you will, of, instituting policy and change. There's a whole nother thing about modeling it. And this is something that's been really personally important to me, is making sure that as I think about well-being, I am not just creating policy. This is not an area, I believe, where you can create policy and not necessarily do it as a leader. So, for example, one of the things that we've had success with doing in the past, and these are things that are really, not really a cost to your organization if you do it right. We created every Tuesday and Thursday meeting-free windows. Meeting-free windows, that's simple. 3 hours each day in the morning where a team could spend time together as a team, but you couldn't have meetings with people outside of your team and or people external to the organization. And you could also spend time rounding and connecting and or promoting just general well-being. One of the things that, my team would do during these meeting-free windows, and we haven't done this in a while, so I need to get back on this, is take a walk for lunch as a team. And so as a leader, you're modeling that because you're getting away from the unit. And I know that sometimes, in the clinical environment, this is easier said than done, but you can walk around the unit. You can grab a quick bite to eat in the break room together. But you are together, you're not having meetings about specific work-related topics unless it's important to building of the team. And so those are simple things that can really show that as a leader, you believe that well-being, resiliency, those types of things, combating burnout and talking about it openly as a team is really, really important. And it's something that I believe has been beneficial here. We've all heard the phrase shadow of the leader. And one of the things that my board always tells me here, and I really believe in this, is leadership matters. Leadership matters in everything that we do, and modeling it in this way, when you're talking about well-being, I can't really think of anything more critical than the leader showing that by acting that they believe in it and that it's okay. I think that's really important. These are some elements of a leadership-driven well-being program, and I think that they're probably fairly intuitive. I'm going to walk through them briefly. I've already talked through setting the strategy, and I will say, these are a few that we wanted to share with you today. But I would say there are more that may work better for your organization. But at the top of it is going to be, and I can't stress the importance of having a strategy around well-being, because again, there are a lot of different things that you can do that may or may not work for the needs of your workforce at the present time. You have to understand what those needs are, and you have to build your strategy around it, because again, you want to be cost conscious. You want to be able to resource whatever it is that you do, and you want to be able to follow it through. So I think that's something that's going to continue to be important again, and you want to constantly, well, I shouldn't say constantly, but you just want to enhance it routinely, your strategy, because this is an area that the needs of the workforce will continue to evolve, change, grow, and probably will look different a year from now than they do today. So while not constantly, so correct myself in saying that, because that wouldn't be realistic with all the other priorities that we all have, but you want to routinely be reviewing and evolving your strategy. Also, you want to create a supportive culture. And so what I mean by this is, you as the leader want to create a positive work environment. We all want to live in a positive work environment, be in a positive work environment. But a lot of that is really promoted by, because that can be different, what exactly that means for each one of us. So you want to encourage open lines of communication. And I want to share with you all something that we're doing here at the University of Miami, where I use the example quite often. I have a 9-year-old little girl, and she can, on her own, you may or may not disagree with me that I bought a 9-year-old an iPhone, but I did. And on her own phone, she can swipe right and buy something. She can swipe left and return it. She can tell them, Amazon usually, why she doesn't like it or why she did like it and if she would buy it again. But I share that simple example because sometimes I feel like when we sit down at our desks, at these desks at the office or on the unit, wherever you might work in your day-to-day, that you feel like you kind of take a step back. You don't have the opportunity in a very modern way to share bi-directionally with your leadership and them with you, what's going on, what are the priorities, what is the strategy, what is working well for you, what could foster. I mean, we get the best ideas from our workforce. So having opportunities for what could foster enhanced engagement and resiliency is something that, we can and should do. So here's one of the ways in which we're doing that here at the University of Miami. So we've created this centralized repository. We call it the Hub. We're getting ready to roll it out to our workforce. And you saw that you could access it via app. You can access it on your desktop. But this is kind of that one-stop shop where you can go for information, both kind of real-time current information about, news, things that are happening, events that you can participate in. The other really cool thing that I love about it is that the workforce is going to be able to comment about things that are going on that they're seeing. They're going to be able to respond to questions, provide feedback. It's going to be what I like to refer to as simple bi-directional communication amongst the university, its leaders, the health system, its leaders, and the workforce. So I'm really excited about rolling this out. And I hope maybe I'll be invited back to tell you how it's going. But I really do think having the same at least a consistent environment to what we get in our personal lives in terms of modern means of gathering of information and providing feedback is really important to the well-being of the workforce. Knowing what is going on, what decisions are being made, how to comment about how those things impact your day-to-day work experience, we believe is critically important. And like I said, we're really excited to see how that turns out for us, but we do have high hopes. Also, we think it's really important, again, to recognize and reward the efforts of our workforce. This is something, frankly, that we learned as part of that comprehensive engagement program, that it is so important for our workforce. They want to be recognized individually and as teams. So we always, think about the awards that we get nationally, being an employer of choice, et cetera. But also recognizing the contributions of our individual members of our workforce is something that they've asked for, and celebrating that success is something that we are doing as an organization, and that is working well. And promoting flexibility and balance, managing the schedule. We all know that this is, again, a balance, for lack of a better way of putting it, but having different schedules, looking at your staffing ratios, that's something that we have done that has really worked well for us, and continuing to evolve that. Again, I know that the fiscal cost of some of those things can be a delicate balance. So working hand in hand, my team in HR, with the operational leaders, with finance, this is a day-to-day kind of blocking and tackling thing that we all work together around. But we're doing it because we want to have a model where we can promote flexibility and balance. And it's, again, these are all things that we continue to look at. I've already talked about modeling. That's something, again, I personally do. I personally think it's really important. And I will also share with all of you, it helps me to be a better leader when I have whatever works for you to kind of decompress. But for me, I do like physical fitness. And that's something that as busy as I get, I will always find time for that throughout my day, because I 100% know it makes me a better leader. I'm modeling it, but it also really does help my own mental status for sure. And then providing resources and support. But another thing that's really important is ensuring accountability, and to overall organizational leadership must set expectations with the other leaders in the organization. I set an expectation with all leaders in the organization to set an engagement goal. That was a requirement, and everybody, did it. And it really, the organization is better for it, for all units to have a goal. We have organizational goals across the board in terms of promoting workforce engagement, but there are needs that each individual unit has, and we wanted those leaders to establish and then work on with their teams what those goals are. Okay. And again, like I said early on, we believe here at the University of Miami that what gets measured gets done. We also believe in continuous improvement. We are not afraid to say, you've heard me say evolve, enhance. Those are great words to use, in my opinion, with your workforce, because it lets them know that you are constantly looking at the data, that you're making insights from those, or taking insights from those data, and that you're making action plans to do something about things that you need to do. So these are a few examples in terms of data that I'm constantly looking at, benchmarking trends and best practices. I just I'm hoping to share some of what I have learned throughout my career with all of you today. I have lots of opportunity to learn from many others like you through these types of webinars and other events that I go to. I find both my internal network, obviously, in terms of relationship building and trends and best practices is critically important, is equally important as what's going on outside of the University of Miami, because I know that many of you are coming up with great ideas and innovations that could benefit the workforce here. So just, it's something that I actually think about and pay attention to every week, maybe not every day, where I spend a little bit of my discretionary time and energy on making sure that I am staying fresh on best practices in my field in healthcare and higher education across the country. And by those same to the same tune there, we're also looking at pay equity and total rewards packages and just things that you are all looking at. Turnover, where are you? What units are you experiencing the highest degrees of turnover? We look a lot here at productivity of the clinical workforce. We have lots of tools that measure productivity. We're evolving and enhancing how we're looking at that. Also making sure that the development of the workforce, we monitor who's moving up internally. What are those promotion rates? And you also do need to look at, when you're looking at your well-being programming and what it is that you might perhaps need to do, you need to look at your absenteeism, work-related injuries. We know that when people are stressed, there are more medical errors. You need to make sure you're looking at usage of your PTO. You may or may not have PTO, you may have sick leave, you may have vacation leave, but really, looking at the data, marrying the data where it makes sense. Many organizations, including mine, you have subject matter experts who are producing reports for you and scorecards. Some of these things, if you don't have people who are dedicated to workforce analytics, your IT departments, certainly I'm sure can help you, get some of these insights, or there are other third parties that can help you using your employment system of record to be able to garner some of these insights, including time and attendance tools that many of us use, like Kronos and Simpler. But there's lots of insights, might be in different systems. You might not have people who are dedicated to this work, but it is critically important to make sure that you've got the ability to have some good data sets and that you're able to provide some insights so that you can take action. And then as we think about what's going to happen in terms of the headwinds in the future, there's lots of conversation going on around sustainability, and this is kind of the environmental impacts that we're surely going to see over the next many years and how those impact the workforce. The advent that has really come on full force around AI, artificial intelligence, chat GPT, you name it. How do those intersect with the well-being of the workforce? Some of the things that we're doing, as I'm sure many of you are doing, is in the electronic health record, making sure that, where we do insert artificial intelligence, we're doing it obviously in a thoughtful way, but one that might free up the clinical workforce in terms of administration and administrative duties to free them up to do other things that could promote resiliency is going to be something that we'll all need to continue to pay attention to. And then again, we need to continue to focus on both stability in terms of how people feel about their careers, but also mobility. I always say that I don't want people to leave the University of Miami. They may want to grow and do something different, and we want to help them do that. But those are conversations, again, that, we need to continue to think about and have. And then the overall societal impact on, as we think about, for example, the needs that we have from the community here in Miami. We have a very dense population, and we have a huge demand for our services. We want to make sure that as we build the resiliency of the healthcare workforce, including the one that I am responsible for at the University of Miami, that they're equipped with the resiliency and the well-being programming that they need to meet those demands that continue to grow as we have seen shrinking pipelines in the healthcare workforce. But with that, I think I've come to the end. And I would love the opportunity to take questions. Thank you. For those of you who don't know, this is at the University of Miami. This is our U. We are orange and green and proud of it. But I really am delighted to have had the opportunity to spend a little bit of time with you here, sharing some of my own personal perspective and that of the University of Miami.
And thank you so much. Such an incredibly insightful conversation. We were happy today. You shared not only a leadership perspective from within an organization, but you're truly a thought leader in the field. And so we just really appreciate having you here chatting with us.
Of course.
We've had a couple of questions in the chat box, but this is our time for Q&A. The first one was talking about your app. So the question's from Eunice. She's asking if the bidirectional app is for leadership only. Do you want to maybe chat a little bit more detail about the app? We've got some interest.
Happy to. That's been a bit of a pet project of myself and my team. It is not, it is for the entire workforce. So I'm sure many of you have had what is referred to as an intranet that can be done through a number of technology services, if you will. Microsoft has one referred to as SharePoint as an example. Those tend to be a little bit more static and not bi-directional, where they can share information but not receive it. But so this was something that was important for us. There are a number of providers. We didn't have the internal resources to be able to do it exclusively. I've got a couple members of my team on here with me today, and they would not be happy if I didn't say it's been a heavy lift for them that we just exclusively use third-party assistance. It's been a very heavy lift for the team because it does have to marry with your internal workforce data. In addition to, we have to build the kind of muscle memory with the leaders, which again, these are all things that we're going to continue to do because now people are going to comment about something that has to do with HR. So I have to go out. I should say I want to, and I will be delighted to go out and comment. And so again, the idea is it's bi-directional, but the platform itself, we needed third-party assistance to be able to support that type of technology, but it is also an internal lift. And if, that's not something that you're able to focus on right now, and I will tell you, it's been a good year and change in the making. So from selecting the third party, contracting with the third party, and then all of the kind of, again, that lift, as I refer to it, to get it ready to go live, took a little bit of time. So, it'll be something that you'll want to think about. But we're really excited about it, but it's for the entire workforce. Really, really important. I should comment too that this was something, while it's a pet project of mine personally, because I believe in having that modern and sophisticated approach with the workforce. It was also something the workforce told us they wanted. They wanted more opportunity to hear from university leaders and also to be able to share on a more regular basis what was working for them and what we could do differently as an organization.
A modern way to stay in touch, and as you say, bringing the data into it as well. That's amazing. Eunice, did you have any more questions on the topic of the app you'd like to ask? You're welcome to unmute or type them in the chat. We also
thank you for going a little more in depth on that. I appreciate it very much. Thank you.
Lori Gert has a question. So she's wondering, what kinds of training do your leadership receive to build that empathetic leadership skill?
So humbly, I will say we do have a wonderful team that focuses on a couple of things, but one of the key important aspects of their role is to focus on leadership development. And you've heard me say a couple times, it's really important that we continue to leverage great programming that we have, but also that we're evolving it. Like I continued, like I said, to use that word. So in the leadership development space, we have a couple of programs exclusively for leaders, including new leaders, as I'm sure many of you do. And one of our most comprehensive programs is called Essentials of Leadership, EOL. It's a many months long program. We are currently on the 19th cohort. We just graduated, actually, the 19th cohort of that program. So it's been in place here at the university for many years. It's a mixture of higher education and healthcare professionals, but they do focus on, there are a number of segments of that is focused on empathetic leadership, on crucial and critical conversations, on active listening, on the business and the operational aspects. It's very multifaceted in terms of the program. Where we have evolved, really, we are, for example, we're opening up 2 very large new ambulatory service centers. So we have developed programming exclusively. It's kind of an offshoot of that Essentials of Leadership I just referred to, but it's exclusive to the ambulatory, we call it ambulatory leadership development program for those specific sites to make sure that those leaders get the growth that they need for those sites specific in that particular area of our business, so to speak. But so it's definitely, again, something that we focus on that I think that we do really well here. But again, we continue to review it and make sure we've got very specific aspects that are focused on where we are going in terms of our growth.
Site specific, and 19 cohorts have gone through. You must have a lot of lessons learned there. That's incredible.
Yeah, but let me share, we also track out of the cohorts who goes where. So we track, where those individuals go when they're promoted here at the university. So it's really important, again, to make sure that you're following the data, because we want to, again, make sure we've got programming that is beneficial to the organization and to each individual.
Lori, did you have any follow-up questions for Allison on the leadership training?
All good, thank you.
Any other questions for Allison while we go? Feel free to use the chat or unmute yourself. We only have a few minutes left, but I had a number of questions. Maybe we'll just start with the first one that I had, and the sub question here. And I would love to know, what is one piece of advice? And I know that you shared a lot, actually, this is really fantastic, but what's one piece of advice for organizations looking to make the healthcare setting a more person-centered place of employment? What would you say if you had sort of one piece of advice to give to somebody?
For me, it goes back to that, whatever mechanism you're going to use, or mechanisms, you must have a comprehensive listening strategy where the leaders are having an opportunity to hear directly from the workforce, what is on their mind, what is a barrier to their well-being, to their productivity, to their overall engagement. Because if leaders don't have a good handle on, kind of that local level feedback, there's just a lot of opportunity for things to go awry. And, just let me share with you a brief example. This was a number of years ago. I was called to a meeting, and it was a kind of motley crew of individuals. It was the former CEO who was still on the faculty at the time. It was a nursing leader, and it was, many others. It was probably about 8 people, and they were simply asking for my help. And what they were asking for my help around was, this group of individuals had come together over time when there was a need that was identified to them amongst the workforce. The needs could have included a range of things like food insecurity, homelessness amongst the workforce, transportation related issues, just a number of things impacting the workforce on an individualized basis, where it would cause this group to come together informally to do a coat drive, or to get gift certificates so that people could buy groceries. And I just remember sitting there and I was kind of taken aback that how informal it was. And I was, hugely humbled and impressed that, there were, group of people from, different areas of the health system that, had come together over time, again, informally, to support as dramatic, needs that people had, like food insecurity, and events of homelessness. I mean, we have a wide range of positions in the healthcare setting today. And again, with that brings a wide range of points in time in one's life and instances and things that it can affect any individual across the organization. So what they were asking for my help was to really create a more formalized structure, so that we could, as an overall organization, support those types of needs that are often either people do not feel like they have a place to go to share those types of needs, or they feel like that their employer is not going to want to help. And, I think, probably everybody in the webinar today would definitely raise their hand and want to help in those kinds of circumstances. But if you're not listening, and you don't have those mechanisms where people feel comfortable in order to share how can we expect somebody to show up at work and be productive when they're not sure where their family is going to get their next meal, or where they're, they come in and work a shift and they go into a shelter at night. And all of the other things that must be on their mind. If we can find a way, because, many of us have larger organizations that have community connections to help support those needs of the healthcare worker today. We are promoting that resiliency. We are reducing stress. And we're being good community members and good citizens of the world. So I think those things are really important in creating comprehensive ways that we can listen and get that feedback is really important.
Thanks, Allison. And you make such a great point that social needs are important for, people that live in a, smaller community, but also in big cities like a destination city, as you're saying, social needs exist for staff and they need to be recognized, and listening is how you do that. Now that's fantastic. Thank you. And we're coming to the end of our time. We had quite a few more questions to go through, but I think we might call it there. Let's click through. We should probably do this again sometime, meet again. I just wanted to thank you so much, Allison. This was just fantastic talk with you today. Value so much this perspective as I mentioned, not only a leader in your organization and working at that perspective, but truly a leader in the field. Such insightful information that you shared with us today. So thank you so much. I want to remind folks on the line, session 4 is next Wednesday, where we're hearing from Karen Garvey at Parkland Health in Texas, from weariness to wellness, hospital structure of peer support through just culture and trustworthiness. So that's what we've got coming up next week, the 4th session of our 6-session series. And I just wanted to remind you that at the end of the week, the AHA is having Hospitals Against Violence Day. So June 7th is their day. That's a nice public thing for us all to promote. So thank you, everybody. Have a great rest of your day. We'll catch you next week. I appreciate everybody coming in today. And thank you so much. Enjoying this series thoroughly. Have a great one. Bye, everybody.
Bye,
Thank you.
everyone.